Many people take painkillers without thinking twice. But what if that common medicine is slowly damaging your kidneys? Drugs like ibuprofen and diclofenac are widely used for pain, fever, and inflammation. But here's the problem. Your kidneys need proper blood flow to work normally. These medicines can reduce that blood flow, and over time, this may lead to kidney injury. The risk becomes higher if you take high doses, use them frequently, are dehydrated, or already have kidney problems. In many cases, the damage is silent. You may not notice it until it becomes serious. Here's a common myth. If a medicine is available over the counter, it must be completely safe. But the truth is, even common painkillers can be harmful when used incorrectly. So what should you do? Use the lowest effective dose. Avoid long-term use without medical advice. Stay well hydrated. And if you have kidney disease, always consult a doctor before taking these medicines. Remember, pain relief should never come at the cost of long-term damage. Follow for simple, doctor-explained medical concepts.